Okay, we have two presenters joining us here this morning. Dr. Sue Hughes directs the Center for Research on Health and Aging at the University of Illinois at Chicago and is principal investigator on the center's Midwest Royal Center grant from the National Institute on Aging. Dr. Hughes designed and tested the nationally recognized Fit and Strong exercise behavior change program for older adults. Paige Dennison is chair for the EBLC, overseeing research coordination, development, licensing, and national dissemination of enhanced fitness and enhanced wellness. Paige also directs the Health and Wellness Department at Sound Generations, a multi-service community-based organization serving older adults, and serves on the Exercise is Medicine Older Adult Advisory Committee for the American College of Sports Medicine. And with that, I would like to turn the presentation over to Sue and Paige. Welcome.
Thanks so much, Steve. I think I'm probably going to go first and discuss today's objectives, but I think Paige and I both want to just thank you so much and to thank ASA for this opportunity to help spread the word about the 4Ms and the EBLC crosswalk that can be used to achieve them. Paige, would you like to, say hello?
Absolutely. Hello, everyone. Thank you for being here today, and we're looking forward to talking with you.
Okay, so this is Sue again, and I'm going to get right into today's objectives. So our objectives today are to describe the Age-Friendly Health System Initiative to you. What is this all about? We also want to talk about the emergence of the 4Ms, why and how that happened, and how they are used to measure impact of the initiative. And we also want to explain what evidence-based programs are, in case anybody on the call doesn't know about that, and basically get into a demonstration of how you can translate or crosswalk the EBP program findings to make them fit within the 4Ms framework. And finally, describe how you can use the evidence-based programs to achieve the 4Ms in practice. And in doing that, we really want to point out the wonderful congruence between the EBP outcomes and the 4Ms. So just a word about the Age-Friendly Health System Initiative, funded by the John A. Hartford Foundation and led by the Institute for Healthcare Improvement within the foundation. And it also has important partnerships with the American Hospital Association and the Catholic Health Association of the United States. So what is an age-friendly system? As you go down these bullets, I think you can recognize that this is all about value. And it's achieving value and quality by emphasizing patient-centeredness of care. So an age-friendly system is one where every older adult gets the best care possible, experiences no healthcare-related harms, is satisfied with the health care they receive. Value is optimized. We hear a lot of talk about value these days. So the Age-Friendly Health System Initiative addresses this, is very concerned with optimizing value for all stakeholders, for patients, families, caregivers, healthcare providers, and the overall system. How is the system going to achieve this? Well, the network has identified 4 overarching constructs called the 4Ms to guide their work. So here are the 4Ms. Before we go over them, I would really like to just briefly give you some background. These were developed by extensive literature reviews and extensive meetings with multiple key informants over, multiple meetings. Many different attributes of age-friendly systems were discussed. And the brilliance of this approach is that they were able to boil them all down to the 4Ms, which people can really remember and operationalize. So the first M is what matters. So this refers to the importance of knowing and aligning care with each older adult's specific health outcomes goals, and care preferences. So what that means is that providers need to sit down, get older adults to articulate these things, and document them and align care with those goals. Mentation is described very comprehensively. It includes the prevention, identification, treatment, and management of dementia, depression, and delirium across settings. Mobility, we all understand the importance of mobility, and I think we all agree that it's very, very important to ensure that older adults maintain their function, mobility, which will enable them to achieve what matters to them. Medications, we all know that older adults have multiple chronic conditions, and we know that they use multiple medications that could potentially have harmful interactions. So this last forum is basically pointing out the importance of using medications that do not interfere with what matters, mobility or mentation. Okay, so here is just a quick schematic version of the presentation of the 4 M's. I've already described them, so I'm going to move to the next slide. Oh, okay, so sorry. This is an interactive presentation, and Paige and I are very curious to ask you some questions during it. So the first poll that we want to conduct is basically going to ask you to tell us about yourselves, and specifically we'd like to know what industry you work in, and we'll be quickly looking at the responses. Okay. Steve, are you going to?
Yes, the poll is live right now.
Okay, great.
Okay, presenters, can you see those results up there on the screen? Yes? No? Okay.
No?
I'll just run a quick result for you here.
Okay.
CBO, we have 10%. Healthcare, we have 35%. AAA, we have 11%. Government, we have 13%. University, we have 3%, and other, we have 25%.
All right. Sounds very interesting. So at this point, I'm going to just turn it over to Paige, and Paige is going to carry on with the description of the evidence-based programs.
Wonderful. Thank you, Sue. And thanks to everyone on the line for the opportunity to speak with you again today. As Steve said, in addition to working with the EVLC, I oversee the Health and Wellness Department at Sound Generations, a multi-service community-based organization in Seattle. And within our Health and Wellness Department, we deliver multiple evidence-based programs regionally and 2 nationally, Enhanced Wellness and Enhanced Fitness. So what I'd like to start out with is grounding our conversation today by defining EBPs, as we call them, or evidence-based programs, by the bullets that you see here on the slide. These are programs that have been rigorously tested in controlled settings, proven effective, and then translated into practical models. It's also important that the evaluations themselves have been subjected to critical peer review. And evidence-based programs can add value in many ways. By concentrating an organization's limited resources on proven programs, by allowing administrators to focus on delivery rather than development, improving reach and impact, and most importantly, by measurably improving participant health. Let's focus in on the participant now by taking a few minutes to be with Sharon. Steve, if we could pull up the Aging with Grace video. Being with Sharon as she experiences two evidence-based programs, Enhanced Wellness and A Matter of Balance.
Yes, here we go.
Every day, thousands of Americans become senior citizens. As the years go by, aging with grace is a challenge.
Do you use your cane all the time?
But for people with a disability, aging with grace also takes courage.
I was diagnosed with MS in 1992.
For Sharon Goldberg George, the diagnosis was already devastating. But then,
a few years ago I had a very traumatic accident, and they use this big word in the MS Society, exacerbated my MS, and I got markedly worse. I aged a whole lot more because I moved less, I was less active, I became sort of sedentary.
If we ever wanted to meet here.
To get moving again, Sharon needed motivation and a coach. She found both through the University of Washington.
Nikki's made a huge difference in my life with the Enhanced Wellness program.
The Healthy Aging Research Center at the University of Washington is leading the conversation around what healthy aging means for people with disabilities.
We're going down toward the floor. 4.
Enhanced Wellness is an umbrella. It's a program where an individual in the program works with a coach to identify particular goals that are important for them, and then that coach kind of helps keep them on track towards meeting those goals.
Ivan Moulton, a University of Washington rehab psychologist, leads a study that focuses on this underserved population.
We've spent the vast majority of our research efforts and our intervention efforts on people who were able-bodied and were aging into disability, but very little on people who were aging with disability.
This study focuses on whether or not the Enhanced Wellness program is effective with people who have muscular dystrophy, MS, post-polio syndrome, and spinal cord injury.
Everything is harder if you have a long-term physical disability in terms of your health in later life.
12, were you helping me?
Because of the Enhanced Wellness program, Sharon found the perfect class at North Shore Senior Center. Even though she's much younger than her classmates, the exercises enhance her quality of life.
A Matter of Balance class looked just right for me because I have a matter of balance. It's great. You know, they talk a lot about taking falls and avoiding that kind of thing, and just doing some exercises that really help you get stronger.
Enhanced Wellness is all about self-management.
Do you tend to drag it or kick it?
We break it down into little manageable steps, and that has been so helpful because I've been completely overwhelmed by being not as able as I want to be. I'm getting emotional.
They have some ideas you didn't.
I can learn from them.
Working with Nikki helps Sharon to live in the solution rather than the problem.
I try to focus on just doing some exercises that really help you get stronger, and that really helps.
In a very short period of time, Sharon has made so much progress, and being able to join people in that journey is so rewarding.
But the most important incentive for Sharon is her daughter, Lily.
I just love her. It's just wonderful. I needed to have enough energy to do things with her. I kind of embraced them, and I knew that I could change things in my life, and that's why I'm here, and that's why it's working.
What about you, Sharon? So to be able to be in the positive with people and to realize the kind of changes that they can make in their lives is really energizing and inspiring.
Thank you, Steve. Using a 4M lens, we just saw through Sharon's experience that evidence-based health promotion programs can make a huge difference in a participant's life, whether they be aging with or into disability. And the Evidence-Based Leadership Council, I'll go here to the next slide. Steve, I'm having a little difficulty doing that. If you could help me. It disappeared when the video came up.
It just moved.
Okay, I'm just seeing the video overlay right now. So
just go back to the slides tab.
There, I got it. Okay, thank you.
Okay. Sure.
Thanks everyone for your patience. That the Evidence-Based Leadership Collaborative, or EBLC as we call it, came together to focus and scale these programs for diverse adult populations. We consist of 11 directors representing evidence-based program administrators, community-based delivery organizations, healthcare, and research institutions. And I'd like to quickly go through the programs that currently comprise EBLC. They fall into 3 categories: targeting chronic disease and medication management, depression, and falls management and physical activity. All the EBLC programs meet the United States Health and Human Services Administration for Community Living's criteria for 3D funding, so the highest level of evidence. So let's take a look at the chronic disease and medication management programs that are currently part of the EBLC there. You see the chronic disease self-management program, which is widely available, as well as some disease-specific self-management, including online, home meds, the enhanced wellness program that we just saw, and the Spanish adaptation. Depression programs, Healthy Ideas, and the PEARLS program, as well as falls management and physical activity programs, A Matter of Balance, Enhanced Fitness, and Fit and Strong, which we'll be hearing more about shortly, as well as Healthy Moves. We'd like to do another poll right now. If we could pull up poll 2, Steve. I'm going to go back one. There we go. And who's currently delivering or referring to evidence-based programs as an integrated part of their work to improve health outcomes? Let's see. There were so many different categories of work that you all do. I'm really interested to find out who's doing that. I'm very interested to know who's in that 25 other percent there. So let me see. There we go. Okay. Okay, so over 50% of you are currently delivering or referring to evidence-based programs. All right, oh, no, it's going up, shifting. All right, still over 50%. Great. Great, terrific. Well, we hope to give you some insight into some tools to help with that. All right. So I'm going to pass it back over to Sue now to talk about how the evidence-based programs and the forums framework can work together.
Great, Paige. So I'm basically going to talk about how we developed the EBLC crosswalk. So we decided to basically evaluate our programs using the 4Ms framework, and we developed a big grid with the 4Ms, kind of along the side, and our programs along the top, and we basically filled out, what the outcomes are from our programs that are consistent with the 4Ms and facilitate their achievement. So the crosswalk materials are available on the Aging and Disability Business Institute and the EBLC websites, and that link is provided right here. So before going on to the next slide, we want to do poll 3, we're very interested in learning who's already used the crosswalk tool, and if you have, what you used it for. So Steve, can you bring up poll 3?
Yes, it's up right now.
All right. Well, this is very interesting. It looks like the great majority, huge majority of people on the call, about 87% have not used the tool, okay? And let's see, about 3% have. So that's very, very helpful to know as we proceed with the presentation, the webinar. Okay, so let's see, we need to go to the next slide. All right, so what we're doing now is giving you examples of how we have applied the framework. And the first example that we want to start with is the Fit and Strong program. So the Fit and Strong program is a program for older adults with lower extremity osteoarthritis. And, you know, this is how it addresses what matters. These people have painful lower extremity joints that prevent their engagement in physical activity. So Fit and Strong basically helps people who have become deactivated and sedentary because of pain to become reactivated using a personalized physical activity routine. The other thing that's important to know about the program is that it meets 3 times a week for 90 minutes. So the first 60 minutes are physical activity. The last 30 minutes are health education using a structured curriculum and providing participants the opportunity to share their experiences and problem solve. So let's hear from a participant. There's a very quick video now from a participant showing what matters to him.
I go very carefully down on my knee. I'm worried about not getting back up again.
Right.
And I always have the feeling that I'd have to yell down the hallway, I'm fell and I can't get up.
Right.
But I'm very, very careful to make sure I don't fall over or whatever, but I'm taking a lot of time, and I'm noticing it's not as easy as it used to be.
Right. And things are not as easy for him to do as they used to be, and he's basically looking to our program to help with that. So going to go to the second mentation. So as I mentioned earlier, there's a health education portion of the program, and our program is group facility-based program. So that basically enables people to share their experiences both with barriers and facilitators to exercise participation and to managing their chronic condition. So as a result of that, program participants have also shown a reduction in anxiety and depression at 2 months that was maintained at 18 months. So now we want to take a break again, go to a video that will show the participants' experience of the impact of the program on depression.
As you said, when things cascade down and you say, I can't do this, I can't do that, and there's a depression that sets in.
Absolutely.
And you feel like I'm old, I'm over the hill, it's going to be over soon. And as I've gotten older, I've realized that it takes a certain amount of intelligence to find out how to use what you have well. And I think that's what the program has taught me, that being fit and strong is something you can still do regardless of your age.
Absolutely. Yep. Illustrates that this gentleman was depressed, you know, about the pain in his knees and inability to function, and he has gained the ability through the program to use to know the importance of using what you have regardless of age. So moving on to the third M, which is mobility. This is a major focus of Fit and Strong, and we address mobility through an aerobic portion of the physical activity program and also through systematic lower extremity strength training. So what were the impact of this type of training? You can see that the original efficacy trial found significant improvements in self-efficacy for exercise, physical activity engagement, lower extremity stiffness and pain at 2 months that were maintained at 6 and 12 months. So the program ends at 2 months. So the fact that these effects were maintained after the program ends is very important. A follow-up effectiveness study found significant gains in physical activity engagement, lower extremity joint pain and function, and improved lower extremity strength and mobility at 2 months that were maintained at 18 months. So why do we care about lower extremity strength and mobility? We care because they are risk factors for falls and also for mortality. And it's also important to know that these outcomes were measured using performance measures that are very valid. So let's go to another video, our final video, Steve, showing the parts of the class that address the aerobic and lower extremity strengthening components. So you can see from that video that our emphasis on getting people up and getting them moving. So let's move then to the final slide, medications. So medications are the fourth of the 4M, and while medication management is not part of Fit and Strong, not a formal component, the program does address non-pharmaceutical strategies for managing arthritis pain. And we've demonstrated significant reductions in lower extremity joint pain at 2 months that have been maintained at 18 months. Another important fact is that anecdotal evidence suggests program participants decrease their use of pain meds, and they may cease taking blood pressure medications if their blood pressure improves as a result of their engagement in the program. So here are some quotes, some testimonials regarding medications from participants. The first participant is saying, Fit and Strong helped me mentally and physically. I'm walking better, looking better, and eating better. No more knee shots for me. Blood pressure dropped significantly. Similar testimonial from second participant, decided to try the class. After a couple of months, I was running up the stairs and I was walking. I have not needed the yearly cortisone shot in my hip. So those are the 4 M's for Fit and Strong, how we applied them and showed how our outcomes fit within that framework. So now I want to just very briefly spend a couple of slides here on new developments at Fit and Strong. So we all know that lower extremity osteoarthritis is substantially related. There's a great interrelationship between presence of lower extremity OA and weight and overweight. So recognizing the importance of that relationship, we developed a new physical activity and weight loss version. So this uses the same 24-session format, physical activity followed by group problem solving. What we did is we removed redundant material on OA and replaced it with new material on diet and weight loss. And then this new program, we call it Fit and Strong Plus, we compared it in a randomized trial to customary Fit and Strong. So this is just a screenshot of one of the article that we have published in November in Gerontologist with the 2- and 6-month findings for the new program. And I'm going to just summarize them very briefly here. What we found with respect to diet and weight is that the PLUS group experienced modest but significant benefits on weight, BMI, and waist circumference at 2 months that were maintained at 6 months. We also found an impact on lower extremity pain and function. The PLUS group had significantly better outcomes on these measures that were maintained at 6 months and that were not only statistically significant, but clinically significant. They met a cut point for clinical significance. So why do we care about this? We care about it because many times people have been advised, oh, you need to, achieve a 10% weight loss. You need to be exercising 6 times a week to get some benefit with respect to function. Our findings are showing that modest weight loss, modest increase, physical activity engagement are associated with significantly improved clinical functioning. And that's good news for people who are looking for relatively easy ways to improve the quality of their lives. So I am going to stop here and I'm going to turn things over to Paige. Paige is going to describe Enhanced Fitness, which is a fabulous follow-on program to Fit and Strong graduates to help them maintain. So Paige?
Thanks, Sue. I appreciate that. So I'm going to follow up with Sue's great presentation about how a fall prevention physical activity program really fits the 4 M's, and just give another example of enhanced fitness as a physical activity and falls prevention programs, and how it touches on the 4 M's. And so when we look at what matters, Enhanced Fitness is an ongoing program. So it is not time-bound, so it's a great referral on program. What next after we've activated folks? And the program focuses on improving the overall functional fitness and well-being of older adults. And it is, very socially engaging and has a purposeful structure. It also has been proven to decrease healthcare costs, $945 per individual, as well as the number of unplanned hospitalizations and a decreased mortality rate among participants. I'm going to be a little brief here going through the slides because I want to make sure that we have a good amount of time to show you how to find these great programs. So moving on to mentation, talking about the ongoing nature of the class structure, it does create this socially enduring unit that helps, it's a time of connection where folks can then find other resources as well. It's supportive of consistent mastery of that physical activity, taking it beyond the class, and really a fitness family develops within the class. So the original research study showed a 52% improvement in depression, as well as a 13% improvement in social function. Looking at mobility, Enhanced Fitness is a class that really serves people from frail to fit, so both seated and standing exercises, modifications are involved, and supports individual goal setting within the structure of the program. So it is ongoing. There's a baseline capture of fitness assessment for upper body strength, lower body strength, and agility. And then that's captured again at 4 months and ongoing through time for the class. And really using those individual activity summaries to motivate the participant to continue coming to class, right? That's the dose of the physical activity, and also to see, you know, how they are improving or maintaining while they're aging their strength and their function. Research studies have shown improvement in physical function, strength, agility, balance, and blood pressure, and really a high satisfaction and confidence to continue to exercise regularly. And through a review of medical claims, consistent attendance was associated with a 20 to 30% reduction in risk of a medical fall. With medications, more of an anecdotal evidence. This is not something we've really tracked with Enhanced Fitness to date, but there is a suggestion that program participants may decrease their use of pain and blood pressure medication if they experience improvement as a result of physical activity. Like Fit and Strong, both of these programs are authorized for arthritis management through the CDC. So improving pain is definitely an attribute of both the programs. And following a promising pilot that was recently done at the University of Washington, there is a pain management study set to begin shortly for Enhanced Fitness focused on back pain and knee pain. So let's go ahead and, you know, when you have a chance, because I know from the last poll that not many of you had really used that crosswalk yet, but, you know, when you look at how we take these programs and look at them crosswalked to the 4 M's, you can select a program that addresses the needs of your older adult clients and then go to the EBLC locator and find the program if it's in your area to refer to. And if it's not, you can find the program, how to get the program set up in your area. So one more poll question, poll number 4, Steve. Who's used the EBLC locator to find evidence-based programs? Okay, it looks like we have poll 4 up there. There we go. Okay. So a few of you have heard of it, and the majority have not, which means this is going to be new information that we get into, which is great. Let's go back on over to the slides. So how do you find an evidence-based program? The Administration for Community Living, the CDC for arthritis programs, and then also the NCOA websites are great resources for information about evidence-based programs. Many states have locators or listings at the Department of Health sites, but the EBLC has a national program locator for the EBLC programs, and currently as well as additional programs coming on. So we're continuing to add programs that are also approved at the highest level of evidence. There's a searchable map of many of these programs, and I'm going to show you how to use that next. This is located at eblcprograms.org. And as you can see there on the page, when you click on finding a program, that right at the top with the pin that's circled, there's a map of licensed organizations. Why licensed organizations? Well, these are the organizations that we know have, you know, current training in place and are maintaining fidelity to the program. So you can see a whole list there of programs that are currently on the locator. I want to encourage you to continue to go back because we are adding those programs and increasing those numbers. Okay. Also, you can go to the ACL list. Here's that resource. And you're going to come up with the entire list of programs and what each one is focused on. And also the NCOA has a Center for Healthy Aging Resource Center, both for chronic disease self-management programs and for falls prevention. And as we're coming up towards the end of our time, I want to make sure that you have Sue's contact information to learn more about Fit and Strong or the Evidence-Based Leadership Collaborative, as well as mine for Enhanced Fitness and Enhanced Wellness. And then there's our general contact information. Sue, anything else you want to add at this point before we turn it back to Steve for Q&A?
No, Paige, I think you did a great job, and I'm really interested in seeing what questions the folks who are attending have.
Me too. Steve, turning it back over to you.
Okay. Sounds great. Thanks very much, Paige and Sue. A lot of great information. Everyone, it is time for the Q&A portion of today's webinar, so if you want to send any questions, you can submit them now using the questions box that you see up there on your screen. And presenters, let's get to it here. The first question for you: can we get evaluations or tools to track measurable outcomes for exercise classes and nutrition programs?
Yes, we would be happy, if you sent us an email, we'd be more than happy to give you the outcomes that we have used. And they're also, documented in the article. We have several articles out now on the new version of the program that has all of the measurements that we're using. So that article, that information is, available. We're more than happy to share it.
Yes, and we are as well for Enhanced Fitness, but also in general, validated assessments, happy to point you in that direction as well. For the nutrition programs as well. So just reach out to EBLC.
All right. Can you let us know how these programs are being funded?
Sure. Stu, do you want to start?
Well, that's the $64,000 question, right? So,
how much time you got?
The ACL provides, money through Title III-D, which is very important in terms of encouraging providers to basically start doing the program, to obtain the license, to do the training, so on and so forth. Right now, sites that offer the programs have a number of different options that they can do. They can offer the programs, free of charge to participants. They can charge a fee. We're working very hard to try to arrange for third-party reimbursement for the programs, but, that's a work in progress. And Paige, I don't know whether you would like to say something about that.
Sure, absolutely. We do have certainly, and I believe Fit and Strong as well as Enhance, speaking about the physical activity programs, do have some Medicare Advantage plan reimbursement with folks like Silver and Fit and some of those plans available. But these are all very low-cost programs, and they're funded a variety of ways at the site level. And certainly Sue touched on the 3D program at the federal level as well, and community benefit funds. We also, translations are very important in adaptations, and I think we rely a lot on foundations to assist there. So I know we've spoken quite a bit with Grant Makers in Aging. Sue, you've had great support from Retirement Research Foundation for some of your translations as well. So I'm not sure if the question is more focused on how they're funded at, at what level, but whether it means for an organization or participant or site level. So I'm just kind of, that's a broad overview.
Okay, thank you. Next question here, presenters. Do these programs have costs for participants? Is it covered by Medicare or Medicaid or other insurance carriers?
We do not now have Medicare coverage for Fit and Strong. I don't think we have Medicare. Some of the programs, I think, like the Chronic Disease Health Management Program, the diabetes version of that, I believe, is covered by Medicare. So some of the programs are, and some of them are not. It really depends on what CMS has authorized payment for at this point in time. As Paige, already stated, Silver and Fit is a mechanism for sites that offer the program to get some reimbursement through Medicare Advantage plans. We would really like to see more progress made in that area, and it's something that I think EVLC is very interested in working on down the road. Paige, would you like to add anything?
Yeah, absolutely. So the diabetes prevention program was the first prevention program to try to work through the reimbursement piece federally. But now, with the new funding mechanisms that are being looked at and kind of opening up some of those mechanisms with the Chronic Care Act in March of last year, and how that, that's in process, right? We just saw the last draft call letter come out from Medicare. So, folks are looking at covering more of these programs. In some states, there's Medicare waiver funding mechanisms in place. I know here, in putting my community-based organization hat on, at Sound Generations, we deliver the PEARLS program through the Medicare waiver in our state. So there's a variety of mechanisms, but no real overarching right now. I will say with the Enhanced Fitness program, for instance, Kaiser Permanente reimburses their policy holders for it throughout our state. So it's a little bit of patchwork right now, but it's promising, and I think we're moving in the right direction. It's certainly something we are all working towards.
And I just wanted to clarify, Paige, that with respect to the Chronic Care Act, so the Chronic Care Act basically says that Medicare Advantage plans can expand the menu of services that they provide to address social determinants of health. So we are trying to make a strong argument that these programs address social determinants of health because we provide them, for the most part, in communities that serve, underserved and minority older adults.
Yes. And I think one part of it that I'm not sure if we addressed or not, Steve, was do these programs have a cost to participant? They are generally very low cost or no cost. It really depends on how they're funded. They're funded a variety of ways. Some of them are by donation or free, generally.
All right, very good. The next question, presenters, if you could talk a little bit more about the Fit and Strong program. The facilitators for that program, are they social workers or are they PT therapists, or can you just talk about that a little bit?
Sure. So we have two different types of instructors for Fit and Strong. One model uses certified exercise instructors who are certified by any of 10 national physical activity instructor certification bodies. So that's one route that we have for instructors. Those instructors get an 8-hour training that is an overlay to their existing physical activity expertise. The other mechanism that is available is our lay leader option. So in this option, persons who have been trained to do chronic disease health management program or have been trained in an arthritis exercise program or in Matter of Balance, we can take them because they already know what an evidence-based program is. They know what fidelity means and so on and so forth. So we can basically take those lay leaders and also train them. In that case, we do an expanded training. It's a 12-hour training. It's a day and a half, because in the second day we give those individuals supplemental information about the mechanics of physical activity. So does that answer the question? And we'd be happy
yes, sounds good to me.
These more.
Okay. Next question for you, presenters. Do you have an assessment tool to track participants' progress throughout the programs?
Paige, do you want to?
Sure. So I think, so that's going to be program specific. So I'll speak to Enhanced Fitness, Enhanced Wellness. We certainly do, and we have a data platform that's real time that folks log into, and that same platform can be used for a Matter of Balance and Pearls. So most programs will have a way to track participant progress in the program. Because remember, all of these programs are measurably improve health. So you are measuring as either with a post-survey measurement or ongoing measurement. So if we look at the physical activity programs, I'm going to pull out Enhanced Fitness. We are regularly measured. There's an enrollment with a health history form initially, and self-reported health at that time, as well as the baseline fitness assessments for the upper and lower body and agility. Then there's a remeasure at 16 weeks on those in those areas, and then again in an ongoing manner. So for some folks that have been in Enhanced Fitness for 15 years, we have 15 years of data showing them through time, and that is shared with them directly. So
and
that would be one example. Mm-hmm.
So we do a similar kind of thing for Fit and Strong. We have an online program that participants who are licensed to offer the program the instructors can enter baseline and post-test information for participants. We also have the ability for them to track attendance and for us to be able to observe that. So yeah, I think we're all interested in monitoring outcomes over time, and as we disseminate the programs broadly and bring them to scale.
All right, great. Next question. I operate a senior center which offers many programs such as exercise, fall prevention, nutrition programs, etc. And I want to find tools to measure outcomes for reporting to possible grant opportunities and discussions with healthcare providers. Can you offer any insight on that?
All right, so if they are evidence-based programs, those tools should be part of the program. But certainly, as with the previous question about measuring physical activity for general tools, there's an area on the EBLC website, or you certainly can reach out to us, and we'll try to point you in the right direction with just a little bit more information. Sue, do you have anything to add there?
Well, what we've done for outcomes for Fit and Strong is we have tried to come up with a reduced set of outcomes that are, for the major studies we've done, we've used very detailed instruments. For the ongoing translation part, we're trying to use a reduced set of scales that have a smaller number of items, are still reliable and valid, but are relatively easy to implement in the field. So we'd be happy to, kind of share that list of outcomes with anybody for both the physical activity and diet.
All right, great. Next question, presenters. Do you have any experience or recommendations on how to engage providers to refer to these programs?
Fantastic question. I think that's really, the goal of all of the members of EBLC is to work on developing a provider referral network, and that could potentially be a very important element of the health, of this whole healthy aging initiative or age-friendly initiative. So, Paige, would you like to add something to this one?
Yeah, a couple of things. One, I would really plug the crosswalk tool that we've discussed today. It takes the measures of the 4 M's with the evidence-based program and provides this really clear format on how to talk about things that are important to the age-friendly health system. And then, just kind of more broadly, I think what we've heard from age-friendly health systems is the most direct support would be a link from the annual wellness visit screening, for instance, for falls or depression or cognition or personal health plan, to evidence-based referrals, with products like something like an Aunt Bertha or some of those other programs that allow a direct upload from a system to a community-based organization for the referral to address a whole range of the social determinants like Sue talked about. Interoperability continues to be, in the different systems, continues to be the big sort of nut to crack. But I certainly we're all getting closer, and those conversations are happening all the time now. You can feel like the silos have come down there. So I think that's what my comment would be. Okay. Mm-hmm.
Next question. How do you choose the participants? Independent housing residents really need this programming.
How do we choose participants? Is that what?
Yes.
Okay. Yeah, I'm happy to talk from our experience. We have quite a bit of experience with enhanced fitness and enhanced wellness in public housing and in other residential housing situations, and it's worked very well. It's more right now we're responding to people reaching out to us than, we're all kind of small organizations doing big work, so nonprofit organizations. So we don't have folks going out and really marketing the programs heavily, but certainly when people reach out to us, we respond to them and are very happy to license and bring these programs to independent housing. As a matter of fact, here in our own organization, we have several workshops as well as enhanced fitness and enhanced wellness going on today in residential housing around us.
And this is Sue. I think for Fit and Strong, we basically post flyers when we're starting to have the program be adopted, by a new licensee. We work with them to come up with promotional materials that they can use. One way that is really fantastic to generate interest in a program is to get a story in a local newspaper. Older adults really, the phone will just be ringing off the hook if you can do that. In our flyers, we tend to emphasize that we're looking at people who are having pain and stiffness, in their lower extremity joints, and that seems to be really successful in attracting the right kind of folks, for our program. And we've also found, I just wanted to add that we really are a good program for anybody who has lower extremity issues in addition to arthritis. So for people who have Parkinson's and have other, instability types or balance issues, the program is also, like a nice follow-on program to Matter of Balance that introduces people to some of the basics of exercise. Ours can then take those people, a step further in terms of helping them to really become reconditioned. And then I think Paige's program is an excellent maintenance program, just the best. Any other questions?
Yes, we've actually hit the end of our hour here, and it's time for us to wrap up. But Paige and Sue, I want to thank you for joining us for a great presentation. Thank you.
Thank you, Steve, and thank you, everyone. Reach out to us with more questions. We're happy to answer.
All right, so please don't hesitate to get in touch with us. More than happy to follow up with you.
Absolutely.